Welcome to my YouTube channel. My name is Dr. KT I'm a holistic and integrative physical therapist, and I'm so honored and grateful you're here. Today, I want to talk to you about why you should not be belly breathing. Even if you are a musician, singer, a athlete, a weekend warrior, or human on this planet, basically, if you're a person, you have a body, you should not be doing belly breathing because anatomically, your lungs live in your chest. So if you're breathing and only your abdomen is moving up and down, you're actually not properly diaphragmatic breathing, which is how you should be breathing in general. So, what is proper breathing to begin with? Well, proper breathing is true diaphragmatic breathing where the diaphragm is fully extending downward so that the negative pressure in the lungs can allow the air to drive into the lungs so that you can have air come into your body. Hello, Poochie. Poochie's joining us. Snuggling in, baby. Right here. Yeah. All right. I need you guys to not do this to me while I'm doing the videos. Now we're going to start over. Welcome to Dr. KT I'm so grateful and honored you're here. Please hit subscribe and like this video so you can get more videos just like this, as well as stay up to date with anything I'm sharing. Today, no. Are you breathing correctly or improperly? Hi, I'm Dr. KT. I'm a holistic and integrative physical therapist, and I want to help you figure this out. Before we get started, please hit subscribe, like this video, stay in tune with me so you can always get updates on holistic health, natural healing, and spiritual wellness tips and tricks. So, are you breathing properly? My guess is if you're not a physical therapist, if you've not had education around proper breathing, and you're not in some sort of mobility, exercise, fitness world, you may not know what I'm talking about. Or if you are, you know what I'm talking about, but don't have the full grasp and understanding of the idea around what is proper breathing centered around. Well, so to get started, proper breathing is not diaphragm or belly breathing, it's diaphragmatic breathing. Belly breathing involves just moving your abdomen out. And when you do that, you're actually not properly utilizing all of your lungs in each of the lobes. First off, for starters, at a quick anatomy lesson for you, your lungs live in your chest. They are in this area. I'll show you briefly. I'll just draw it on my body quickly. They live right here. This is where the lungs live. Now, if you are belly breathing, this is your belly. If you're extending outward, you're actually causing a disproportionate change in the abdominal pressure, which changes how the body pulls in air because the lungs are a vacuum. They rely and require that negative pressure to change so that there is a pull and a draw of the air into the body. See, when you inhale, your diaphragm must contract and engage so that it will pull itself into that contracted position so that as you inhale, the air is being brought into the lungs. And when you exhale, the diaphragm is actually going to release and relax and let go without actually engaging. You have some other muscles that are associated with breathing, like the muscles that live between your ribs called your intercostals. Those are a very important muscle for breathing, like your diaphragm. There are some additional muscles that are not muscles that are used for primary breathing. They're accessory muscles, and they live in the abdomen, the lower back, around the neck. And you can commonly see these like your traps, your scalenes. You have another muscle here called your sternocleidomastoid. And then you also have your obliques. You have some other deep, deep muscles like your quadratus lumborum, your QL, your psoas. All of these other muscles play a role in helping stabilize or helping the rib cage produce a certain kind of position so that the lungs themselves can fully expand. Now, there's three motions you need to be aware of when you're breathing. So, when you're belly breathing, what ends up happening is you're only moving the lungs in a forward and backward direction. I'm going to sit to the side so you can see. And I don't like belly breathing because it really doesn't do anything. So, as you can see, when I belly breathe, this is what's extending mostly. Nothing back here is moving. In fact, everything's moving out to the front. All of our world lives in front of us. And so it's easy to forget about what's behind because you know what's behind you. Can't look at it. Unless you're a mom and you have eyes on the back of your head, you know you can see back there. But are you really watching yourself from behind? Or are you looking for others? So When you're in that position, belly breathing is actually not going to properly engage the posterior or the back part aspect of your diaphragm and not effectively getting into the lower lobes and the posterior or the backside lobes of your lungs. So true breathing looks like this. And so you can see a difference. One of the ways that people compensate and breathe a lot all the time is they do this. Two, they belly breathe, kick out, and they lift up. So there's three motions that I want to teach you that you need to be aware of to properly understand how your body breathes. So there's this motion of a piston that's up and down. We're going to set this here. The piston goes like this, up and down. Your diaphragm is going to pull down and then it comes up. So the entire contents of your abdominal cavity needs to go down and up. So the diaphragm is working very strongly with a ton of muscles that help support and stabilize the core, like your transverse abdominis, your internal external oblique, some of the deep rotators like your multifidi, and even working in great relationship with your pelvic floor. There's a ton of muscles down there. So these muscles are all engaged in working together in a coordinated neurological symphony of activation to create that motion of that up and down of that piston. There's two other motions now. The second motion is related to your rib cage. So your ribs have to move for you to properly breathe. And they move like a bucket. So if you imagine there's a bucket here and I'm taking the bucket handle and I'm going like this, that is what the bucket handle motion is happening here in the rib cage. So in order to properly engage that, you have to think about when you're breathing, you're lifting your rib cages out to the side and then you're bringing them back and down. And they kind of move in this arc-like motion. The third motion happens in the front and the back, the anterior and posterior behind, in your sternum and in your thoracic spine, and a little bit of your cervical and lumbar spine as well. But your spine and the sternum are working together and they have to move as well. So if you're doing proper diaphragmatic breathing, this whole area should be moving and feeling engagement. So you ever seen a fireplace bellow where it just was like this, you like little pump fireplace thing? That's the best way I can describe it. Anyways, so the fire pump bellow motion is this. There's a apex, a fixed point, and in that fixed point, there's like this accordion that pushes air out like this. And so that's motion. It's similar to the bucket handle, but rather than the bucket handle having that arc-like motion, this is very linear and it's forward and just kind of in a smaller range of motion. So that's what the front and the back side of your body is doing as you breathe. It's moving like this. So as you breathe, to do proper diaphragmatic breathing, you need to have this coupled awareness, this gross embodiment, and about how your body is moving to produce an action. And specifically, that action is breath. And so when you are in a state of stress, you're in a state of pain, you're in a state of emotional disturbance, trauma, you're reliving something, something's come up subconsciously that's triggered you in this present moment. Your breathing is not going to look like that. And that is because this type of breathing is part of the breathing that is with the rest and digest and letting the body get into a simple, settled, relaxed, cohesive state. When you're in a stressed out state, the body doesn't know good stress from bad stress, it just responds to stress. And when it responds to stress, things change in the body. And one of those things that change is the respiratory system and the respiratory rate and how your body's bringing air in. So it is critical and it's crucial and it is of your utter importance to bring great embodied awareness around your breath. And if you can do that and you can figure out these three motions and how to couple them together, you will create a subconscious hardwired pattern in your brain that produces this subconsciously, involuntarily, outside of that novel new experience of you learning it. It becomes a hardwired, ingrained neurological pathway that is expressed without you having to express it. So this is a part 1 of 2-part series. In the next part, I'm going to show you exactly how to do the diaphragmatic breathing with a specific tool as well, so that you can develop this awareness kinesthetically in your body, so you can hardwire that At the end of the day, if I could have every single patient that I work with, every single client I work with, if they can nail this down, if they can solidify this in their brain, they can work on this exponentially to the new moon and beyond, they would be light years ahead of any person that walks through the door, steps online to work with me, simply because they have the fundamental, foundational awareness how to keep their nervous system in a state of balance. And when you have a balanced nervous system, guess what happens there? Besides magic, healing. And healing isn't quite magical. It seems that way when you don't understand it. But when you understand it, you know that in a balanced neurological state, magic and great things can happen in the body. So stay tuned for part 2. Please like this video, subscribe to this channel, and I look forward to sharing more information with you.